Good morning. So today we will take a class on the sheets that we use for interventional work. Now the first thing is that sheets have got a color coding. So as you know, we always think of pink as a lady's color. So this is the most delicate of all the sheets and it's faux French and it is pink in color. Typically the sheath French will be also written on the hub. For example, you can see it's difficult probably to see it here, but remember, like in the last class we told you, the hub has a lot of information. So here we have got a pink sheath, which is faux French. Also, we have another darker shade of pink, but this is also the same faux French. I'll talk a little bit on the characteristic of some of these sheets, but first remember the color coding. So this is another pink, which is faux French. Then comes the gray sheets. Whenever there is a gray sheet, remember this is a 5 French sheet. If you can see it, but remember this. So whenever the hub or a part of it has got a gray coding, remember it is 5 French and you will also confirm it over here, right? So this is a 5 French sheet, basically useful for a 5 French catheter, or sometimes we can use a 4 French catheter and use the long sheath to inject by the side. Then comes a color which is almost like teal, okay, and this is 6 French, the classical conventional colors. So this is 6 French. Again, if you see, the 6 is written over here in the hub. So it will be written at some place or the other, if you can see it. But remember this color, teal is for 6. And then we have orange, just trying to show you different codings. So here they just put the orange in one spot. They didn't have it at the base hub, but you can see it over here. It's orange and this is the color code for a 7 French sheet. Then we have got blue, which is 8 French. You can see this blue. This is an 8 French sheet. This has got blue. And like I said, always you see the dilator will have the sheet mark. If you can see it over here, you can see the 8 written over here. So remember, you have to know the sheet size for the appropriate device. So all the time, if you take a guiding catheter or if you take a material like say a distal access catheter, it will always mention the appropriate sheet size for a balloon, for a stent, for all of them. So that's why the sheet size matters so much. So black is 9 French, okay? Like you said, again written on the dilator. So black is the coding for 9 and purple is for 10 and yellow is for 11. It's 11 French sheath, okay? Up to 11 French sheath, you can actually technically compress percutaneously if you want, but normally we would use some device as it goes larger beyond 6. So for the first thing we saw is the color coding. Starting once again, pink is 4 French. Then we have got gray, which is 5 French. Then you got teal, which is 6 French. Then we got orange, which is 7 French. Got blue, which is 8 French. Black for 9. Purple for 10. And yellow is 11, right? Most of the time our diagnostic work is done with a 4 or a 5 French sheath, and interventional work is mostly done with the 6, 7 and rarely we go to 8. Larger than that are very rarely used. We use them on the venous side, and of course we got even larger sheets suppose you want to put a stent graft. So the first thing we learned today is the color of a sheath. The next thing we're going to look is the material of a sheath. Now here we have a material which, if you see, it looks like just white plastic. You can see that? It looks like just white plastic, and it is true. It is just like a cheap plastic. The biggest problem with this is if you bend it, they will kink. Can you see that? So imagine trying to use this across a bifurcation. It will never work. So remember, these sheets are meant for a straight vessel for simple accesses. For example, you want to do a femoral puncture, you want to access that, this works fine. But if you want to do something more complex, if you want to take a long sheath that goes from the groin to the carotid, these are not sheaths because they can kink at bends as you enter vessels and can be disastrous. So for that, we have got braided sheaths. Now, for example, this sheath is a bluish looking sheath. It looks got a shape of its own, and if you see, it does not kink. Can you see that? I've taken a whole curve with the sheath, then bent it, and still doesn't bend, right? And if you go into the brain, when we will talk, we can show you sheaths which can take even more acute bend. But can you see that you can actually bend it in these kind of loops? Can you see that? Imagine trying to do that with any other sheath, you'll get nothing. So example, I take the same sheath which I showed you before. Can you see? You cannot attempt anything close to it. You'll destroy the sheath completely. Kinks at every point, remember? So one is a braided sheath versus an unbraided sheath. Have you got that idea? Okay, should be clear about this, that this is a braided sheath. You may get long sheaths which are not braided. For example, this is a long sheath. This must be close to 25 centimeters long. It's got a little tip which looks black, which is called bright tip. Basically, it's a radio opaque tip. But remember, just because it's long, you can't use it across the bifurcation because it will kink badly. So it's good if you're going to go from the iliac into the outer, the tip can show you where it is. So where do you use a bright tip? Very, very useful if you're pulling it down and coming close to the puncture point so that you know exactly that you are still within the vessel and not pulled it out of the puncture, suppose for an ipsilateral iliac stenting. Okay, have you got this idea? So this is called a bright tip. So remember one thing, all long sheaths may not be braided. See, the same thing, if I bend it, will kink. And I just don't feel like destroying this, but it'll just break down if I do. So it's not very often used. We try to avoid this because unless you have an absolutely straight axis, these are challenging. Okay, so we learned two things. The first is the color coding. The second is the material with which sheets are made. They are braided and unbraided. Then we have a huge lot of lengths. But before we do a length, there is also what is the appropriate wire that goes through these devices. For example, a classical sheath of 4 French like this will actually take a 038 wire. And how do you know it? The cover will have it written. The cover will always have the diameter of the appropriate wire written over there. And most of the sheaths we have for conventional use is 038 or 035. Most of them are 038. But when we come to specialty sheaths, the wire will change completely. For example, have a look at this. What does it say over here? Here it tells that the sheath, the wire is 018. Now this is basically a set created exclusively for pedal axis. So let's just show you how this looks. It's another interesting sheath. This is the pedal axis set. It is a sheath with a very fine dilator. We've taken out the dilator and we got a sheath over here. Can you see that? It's really small. The length is just about 7 centimeters long or about 3 inches. But the key thing is it only takes a 1/8 wire. To make this effective, we have got a small little detachable valve, just like you see here. You can just connect it. So these are available from Cook, if I'm not wrong. And they actually make your they can even convert a Ventlon into a sheath if you want. But remember this, so you can have different sheaths having different wires. So it's important that you know what you use. You can't use the wrong wire. It's also important to understand when you take a sheath like this, which typically takes a 3/8 wire. Have any sheath cover? I can just show it. You can't try to take it percutaneously using a 1/8 wire. Because what happens invariably is there is a gap over here between the wire and the dilator. So it actually takes tissue. And this tissue will prevent it from going. So you have to match the sheath to the wire. Have you got it? You have to match the sheath to the wire and then it will work. Okay. So here I'll just show you exactly how the cover would look. Now this is a cover. And if you see over here, it says 035. So So you can see all the detailing, the length of the sheath, the French of the sheath, but also wire. So a typically packed cover also has a wire inside this. You see there's a wire inside. But if you reuse a sheath, you will have to know what wire to use, and conventionally the safety J wire will work for all of them. Now, this sheath for the matter is a very long sheath. If you can see, the tip is really fine. Can you see the tip is really fine? So this is also a sheath that comes with its own wire, and this is a sheath that is used for radial work, and it is also again a 021 wire compatible. Actually, how do you know it's 021? The hub says it. Can you see that? It says 021. So all of these sets will come with their own wires. So this is the wire that goes. And why have they made the sheath long? Because if you put a short sheath in the radial artery, the rest of the artery goes into spasm as soon as you take a catheter. Though you prime the vessel with a combination of a calcium channel blocker and GTN, even then they would tend to go to spasm. So this length will allow the tip of the sheath to be in the distal brachial artery. So the advantage is now, so you can even imagine if I put it on my own hand, can you see what happens? It's actually come all the way to the brachial artery, and so the spasm component is taken care of, and it makes it a lot more atraumatic. So this is the radial sheath, and these sheaths are also again braided. You can see this is a very good quality sheath. You can see it's got a braiding, not as well as the long sheath, but the typical thing is they've got a hydrophilic coating which allows a very smooth access into the radial artery, and it's got length. But the key thing today is to understand, make sure that you use an appropriate wire with an appropriate sheath, or you can have problem. So the second thing we learned is today, the third thing you learned is that sheaths come with different wires, and you have to match the wire to the sheath to work. And most of the time in a pack, they give us an appropriate wire that goes with the sheath, right? The fourth thing in a sheath is the length. So for example, we showed you this ultra short sheath, which is used for pedal access. Then we've got a pediatric sheath, right? The pediatric sheaths are shorter, and the length is how many centimeters? 7 centimeters. So this is a 7 centimeter sheath. It's called a pediatric sheath because an infant will have a very, very small distance between the skin to the femoral artery. So we will have this coming close to the point of the aortic bifurcation in a 1-year-old child or a 3-year-old child. So remember, this is a pediatric set. It takes a 018 wire, very atraumatic. So you can either puncture that with the needles that we talked last time, or with a covered needle or a Gelco, right? So then we talked about a long sheath, and then we got a sheath like these, which is called the Balkan sheath. So what's a Balkan sheath? The Balkan sheath is a crossover sheath created to cross the aortic bifurcation, and so the curve allows us to cross easily. So if you want to do a contralateral work, you want to do a contralateral iliac, contralateral femoral artery, you would like to use a sheath that looks like this. So with the same material, we got much longer sheaths, and Cook makes a lot of sheaths of different lengths. You will have it in 45 cm, you'll have it in 70 cm, you'll have it in 90 cm. Okay, so for example, here is a 5 French long sheath, and if you typically see, the length will be there on the cover or in the hub. So this is a 5 French sheath, and by the length we know that this is a 90 cm long sheath. If you go all the way from the groin all the way up to the carotid artery, this is a braided sheath like I showed it. And where would you use it? If you're doing a procedure, for example, in the external carotid artery. For example, very typically we use this sheath when we do MMA embolization, where we'd have this in the external carotid. Like I said, these are all kink resistant. They can curve, they can rotate, and they are very, very good sheaths. So this is a 5 French. You can get the same thing in 6 French, you can get in 7 French, you can get in 8 French, and even 9 French. Now, the thing that you must remember always is that the length of the hardware should be longer than the sheath. We talked about it last time, that you need at least 10 centimeters beyond it to be functional. And so when you're going to take a device to a 90 centimeter, it's ideal that your catheter like this 125. And so often when we work on the carotid with the long sheath, we use a 70 cm sheath. Okay. Now, for example, look at this sheath. This is a much shorter sheath. This is like 45 centimeters. Very good when you're going to work in the outer, or if you want to cross over. And again, it's a 5 French sheath. Okay, right? And what they do as a marker is they give a gray coding. So this is a 5 French sheath, and different companies make these kind of sheets. Another company that makes it is from a company called Terumo. They call it the destination sheet. Arrow is another company that also makes them. For example, this is the destination sheet. Now you know that if the color is orange, then it is a 7 French sheet. So this destination. So you can see the length. This is again a sheet which is 70 cm, 90 cm, and the cover will have the length. Sometimes the hubs are supposed to mention, but at times it may be missing. I'm not too sure. But remember that this is a 90 cm sheet, takes a 3/8 wire, and it's long and it's braided.
Destination.
So this is another sheet, again braided, but the only difference in this is it's got a detachable hub. So what are the use of a detachable hub? You can actually connect a Y connector. So can you see this hub? So this hub is detachable. So if you want to put hardware, for example, when you want to do a carotid stenting, this is what we use. You connect this hub, and then you see this, you can open it and you can take a device. So this is typically used when we want to do a carotid stenting. When we have a long sheath, it is created for cerebral vessel, but the distal tip is much more atraumatic, and this is called the shuttle. The material is exactly like the Ansel sheath, except the tip is different. Whereas the Ansel sheath, if you see, doesn't have such a long soft tip. For example, you see this Balkan, it doesn't have such a long sheath, but this has got a slightly longer, that's all, and it's a little more atraumatic. But remember, you can have a choice of having a detachable tip, a detachable hub, which I said is very, very useful. You can connect this, or you have the advantage or disadvantage of having a fixed hub over here. So fixed hub have got a valve, and they are sometimes challenging to push devices through it. For example, if you want to take a soft catheter, like a distal access catheter, like a neuron or an aspiration catheter, these are difficult. Sometimes they get it can be difficult to push it through. So typically, it's much better to use a long sheath like the neuro sheath. I'll show you a Ceribase or one of these neuro sheaths to make you understand how they are created. So these are all created in the same way. Okay? These are basically created. This is a long sheath made for brain, so it's really soft. Can you see how the tip is? You just see that. It's so soft, it just sort of bends so easily across your finger. No kinking at all. It can take such a tight angle. I'm just trying to make you understand this. See this? It's really, really soft, and this is so amazing. It can go all the way up to the cavernous segment, because what they have done is they have given different zones, and each zone has a different stiffness, and the stiffness is created by the braiding technology. Okay, but see again here, 7 French, because it's orange. Now you got the hang of it, right? And it's got a hub over here, and this hub you can connect anything to the hub, and most of the time we connect a Y connector. Could be a single Y or a double Y. So here it is. We'll connect this, and then through this we are able to take our devices. So these are much easier to take than the valve. So only difference is the cost. A long sheath like this would cost you quite a bit more. It's like $500, or in Indian rupees about 35,000 rupees. Whereas a long sheath from Cook would cost 5,000 or 6,000 rupees. So the disadvantage is the valve. The advantage is that it is cheaper. The disadvantage again with these Ansel or Cook sheets, they're very stiff. They don't have multiple zones. They got just kind of 2 zones. One zone which is somewhat soft, and then a little more stiffer zone. So the problem is they're not very, very good to cross beyond the carotid bifurcation. Whereas this, which is a dedicated neuro sheath, like we call the the Cerebase or the Infinity or the Ballast. Now, all these are sheaths which are made for going into the brain, and they are much, much better, right? Another company, like I said, who makes sheaths is a company called Arrow. Now, Arrow was the oldest company to start making long sheaths. So it looks fancy because it looks got some steel ribbon like wrapping. Again, the advantage is that it is got the advantage. It's some got kink resistant. I'm not saying it's exactly kink resistant. To some extent, it will work. But if you go beyond these tight things, it can also kink. But it's a very, very good sheath otherwise. Good for crossover maneuvers. Pretty good for going into the carotids. You can get this much of a bend. And this is called the Arrow sheath, and Arrow does not make too many products, and the sheath is one of them. The only advantage, which also works as a disadvantage, is the valve. The valve that is seen in the Arrow is actually a little softer than the Cook. You can see this one, a little softer. So what does it do? It allows you to introduce devices easier, but also remember, when you're pushing things, it slips out easier. So what's tight holds on. Whereas the advantage of having a device with a Y connector, like what I showed for the Cerebase, is you tighten this once you're in target position. So the device inside does not move. So if you ask me, the ideal long sheath should actually have these kind of hubs and should be detachable, especially when it comes to neuro work. But you can still manage with a sheath without it whenever possible. Huh? So just to show you other things, for example, we showed you Cerebase. This is another catheter made by a company called Stryker, which is called Infinity. All are more or less similar in construction. Have a look at it. Got a hub over here. It is, unfortunately, they're not color coded it. So you have to just know the lumen size, and it's called Infinity. Again, the advantage is, see how soft these are. These can take these very acute bends and curves without kinking. Okay, did have a kink right now. So actually, if you notice, Cerebase is slightly better. So they've come with a long sheath called the Infinity Plus, right? Okay, so in today's class, we have seen so many devices, and we will just summarize them for you. The first thing we learned is sheaths come from 4 French and can go all the way classically up to 11, even up to 24 French, right? A color coding is given to make it easier for us. Starts with pink for 4 French, gray for 5 French, green for 6 French, orange for 7 French, and then we have got the black and the blue and the purple as we go to larger sizes, and finally ends up with yellow for the 11 French. The second thing we realized is the wire that goes in varies depending on which the vessel we access. If you want to do a radial access, you want to do a pediatric access, they come with either a 1/8 wire or a 2/1 wire, and as it goes to conventional, it's a 3/5 wire. It's important that you know the appropriate wire before you take it. We also learned that the length of the sheath varies. You can have a very short sheath, which may be just about 7 centimeters, and it can go all the way up to 90 and 100 centimeters. And then you've got materials of sheath which vary. We saw simple plastic sheath which will kink easily, which should not be used in a complex anatomy. And then we have got the braided strength with variable braiding, which is used for neuro, which starts from a tight braid proximally and a very, very soft braid distally that allows us to go very, very distal. And we got the classical Ansel sheaths, which are used in the peripheral vessels for crossover maneuver, entering renal arteries, for the hepatic arteries, for doing a subclavian, and all of them are Ansel sheaths from Cook. You can have a very similar sheath from Termo called the Destination, and also from Arrow. So all these long sheaths can be used, but when it comes to the brain, we use dedicated distal access sheaths. Classically, we showed you the Cerebase from Cordis, and then we have got the Infinity from Stryker, and then we also got a Neuron, which is from Penumbra, and the Ballast, which is from Balt. So these are some of the sheaths that I have. There are some other sheaths maybe in the market, but all of them are absolutely necessary for us. So the question we ask, what is the advantage of these long sheaths? Why do we need it at all? So one of the reasons we need these long sheaths is to give us a support for the catheter. Suppose you got a very tortuous iliac artery, you put a sheath, it straightens anat, makes it easier to do the procedure. The second thing, it allows us to inject contrast. So once you inject contrast, you can place a stent very precisely. You can know exactly where the guiding is going. You can take road maps through it. So it is necessary. Also gives a lot of stability. For example, you want to do a pulmonary AVM. You have got a long sheath and you have got to take a catheter like a 4 French catheter to push the ampullates for. So when you start pushing out the ampullates, sometimes the whole catheter will kick back. So to prevent it, you can have a long sheath which will stabilize it. So long sheaths are also good for stabilizing our devices, for taking away kinks, for giving support to the whole system, and for injecting contrast. So having said that, never forget this fact. The long sheath should be at least a minimum of 10 centimeters shorter than your device. Ideally should be about 15 centimeters. Also remember, match the size to the sheath to the device. So you can have an oversized sheath if you want to inject contrast or run a perfusion running, or you can match the sheath exactly to each other, but sometimes they are tight, and if you can't flush, you may have a clot formation. Okay, that's a morning class on sheaths and how to have many different type of sheaths. We got dedicated sheaths for the pedal access, dedicated sheath for pediatric access, dedicated sheaths for radial access, which I showed you is long, comes up to the brachial artery, and we got dedicated sheaths for distal access into the brain or across the bifurcation.